Hello, my name is Gabby O'Sullivan, and today I'm presenting my 3-minute thesis on the nutritional deficiencies among low-income women and children and the role of the WIC program. This presentation highlights findings from the 2 assignments we've done this semester that focus on the public health issue of nutritional deficiencies and the effectiveness of the WIC program in addressing this problem. In Assignment 1, we were tasked with describing the public health problem. Nutritional deficiencies are a significant public health issue in the United States, particularly for low-income women, infants, and children. Poor nutrition during pregnancy and early childhood can lead to serious health consequences like anemia, low birth weight, and increased infant mortality. For example, anemia can affect 16% of pregnant women, but with an even higher rate among low-income and minority groups. Similarly, low birth weight occurs in 8.5% of live births, and it disproportionately impacts the socioeconomically disadvantaged populations. Alarmingly, Black infants experience an infant mortality rate of 10.61 deaths per 1,000 live births, which is nearly double the national average. Food insecurity exacerbates these issues, with 12.5% of households with children facing this challenge in 2022, with even higher rates among Black and Hispanic families. These statistics highlight the urgent need for the effective interventions that the WIC program provides. In 1974, the Special Supplemental Nutrition Program for Women, Infants, and Children, commonly known as WIC, has played a critical role in addressing nutritional deficiencies among low-income populations. WIC offers services such as nutrition education, supplemental food, and healthcare referrals. Research demonstrates WIC's effectiveness shows a 25% reduction in the prevalence of low birth weight and a 20% decrease in infant mortality among participants. Beyond these outcomes, participants report high satisfaction with WIC services, citing improvements in nutrition knowledge and confidence in providing healthy meals for their children. Despite all of WIC's success, WIC faces challenges in reaching all eligible populations, particularly minority communities who may encounter barriers to access. In Assignment 2, we were tasked to measure the indicators of effectiveness for our programs. To evaluate the effectiveness of WIC interventions, several indicators are used. For knowledge, WIC measures the percentage of participants who can identify iron-rich foods and read food labels. For health outcomes, anemia and low birth weight rates are tracked through health screenings and hospital records. Food access is also another critical indicator with a focus on increasing the availability of fresh produce in underserved areas. Additionally, program participation is monitored by measuring attendance at nutrition education sessions. By collecting data through surveys, health screenings, and program records, WIC ensures that its impact is both measurable and actionable. Looking ahead, there are several opportunities to enhance WIC's impact. Expanding outreach efforts in underserved areas by training 50 additional staff members could help reach more eligible families. By increasing the value of food vouchers by 30%, WIC would enable participants to purchase more fresh fruits and vegetables and improve dietary quality. Finally, enhancing culturally relevant nutrition education materials would make WIC services more accessible and effective for diverse populations. With these adjustments, WIC can continue to address food insecurity and reduce health disparities, ultimately improving the health outcomes of low-income women and children. In conclusion, nutritional deficiencies remain a critical public health issue, particularly for low-income and minority populations. The WIC program has proven to be an effective intervention, and with continued improvements, it has the potential to further reduce food insecurity and promote health equity.